What's up, everybody? This is part 2 of episode 1 of the Redefine Health Ed podcast. In this portion, me and Rachel really get into the nitty-gritty of the psychosocial aspects of working with individuals with cancer. So stay with it all the way through. It's a good episode, and we've got more for you at the end.
So we talked about like the effects of exercise on cancer care. Talk about so probably everybody is wondering, or one of the things that I thought before I got a job there was like, how am I going to deal with somebody who is truly end of life? Or, you know, if they talk about dying, like talk about the psychosocial aspects a little bit and how you have evolved from being a brand new grad straight out of DPT school to now, and how that's changed. So psychosocial aspects.
Oh man, that's a good one.
Such a good one.
And I will say, like, I'm a big personality buff, and we took our Myers-Briggs at the very beginning of school, and I really think because of this job, the core of my personality has changed a little bit, because you can't help but be around these people and appreciate life in a different way. So that's a great question, and I love it. I would say at the beginning, I didn't really feel confident or know what to say to people who had terminal diagnoses. So, there's actually a plethora of people in the cancer world that will not die of cancer because it's getting so good. And so that's the positive and encouraging and super hopeful aspect. But there are those really hard cases where it's really hard to know what to say. One of my most favorite patients, I just for some reason, I just really grew to care about him so deeply in my heart. He had a brain tumor in his cerebellum.
I know who you're talking about.
Yes, he was really young, 34. Played basketball, was awesome. Such a cool, kind guy. And we developed this good relationship, but he just every time I saw him, he progressively got worse. This terrible ataxia attacking his cerebellum, and just it was hard to watch. And I'll never forget, he had an appointment with me right after he saw his oncologist. And at the appointment before me, they told him that there was nothing else that they could do for him. And so he came to me right after, and he's just he was just in his chair. He couldn't sit still because he had so much ataxia. So his neck hurt so bad. And he was just like, Rachel, do you mind just massaging my neck? Just one last time. I just need a little bit of relief. And so I was sitting there massaging his neck, trying not to cry because I knew I had never see him again. And his wife was sitting right there, and they were it was this weird feeling to know that this was the last time I'd ever see this man again. And it was weird, when we got done and I was just looking at them, I just hugged them both. And I was just it was such a pleasure to meet you. And I was know that I'll never forget you. And he said the same thing. He's I'm so happy to have met you. So it was just, even though he passed, and even though I couldn't help him get better, I couldn't help him walk, I hopefully helped him in some of his last days just, be a little bit more comfortable. And I hope that I made him laugh. I hope when he came to PT, he forgot for a second that he didn't have this diagnosis, and that he could laugh and we could talk about music, and, just he could be a young 34-year-old. So I didn't fix anything really, but I hope that I made him enjoy his life a little bit longer and a little bit more fuller and deeper during those times. So he'll always stick with me. And it's something I had to learn, it's something I had to learn to sit with people in their happiness, but also sit with people in their sadness, and be present with them and to listen to them. Because sometimes that's hard. We as people want to fix or want to say it's okay, and sometimes it's not. Sometimes it's not okay. Sometimes it freaking sucks, and it's not fair. It's not fair when you see somebody who's 14 and you know that they're not going to live. So,
oh my gosh.
But I think, I've grown so much in that aspect, and that's why it's changed my personality. It's changed me to be able to see life a little bit through somebody else who can't live it the way they wanted to. So, it's sad, but it's happy, and
Yeah.
it's those people mean so much to me. Like you said, you just don't forget them.
I think that everything that you just said is so incredibly profound, and I will share a little bit about my experience. I think one thing that I learned, I think probably the best or the biggest lesson that I learned working at the cancer center. Of course, I learned a ton of clinical knowledge, and it challenged me so much. But I also learned how to really truly measure and experience somebody's quality of life. Maybe, we always talk about quality of life. We talk about like quality of life measures and how is this affecting or improving or whatever somebody's quality of life. And I think that like for the individuals that I had that I knew it was close to the end for them, it really truly was a space, the clinic that we worked in and the team that we had. It was such a happy, inviting space, and the patients were always happy to be there. And it was okay when it like gave them a little bit of a sense of hope, and it sort of normalized it a little bit more. But just this idea of quality of life, like it doesn't matter how many days you have left on this earth, if we can do anything that we possibly can to help improve your quality of life or make you feel better in some way, then that's really what matters. And sometimes we're physical therapists, but a lot of times we just need to listen. And our physical bodies, in my opinion, are like directly related to everything that's going on in our psyche and our mental state, our cognition, our emotional state is completely, our physical bodies are completely driven by those things. And if we can somehow improve somebody's happiness, even just a little bit, like how much of an effect that has on the way that their body feels.
Mm-hmm.
The one case you sort of mentioned at my 14-year-old, like I'll never forget him. And it's like every day that I worked with him, I would just feel like why is something like this happening to such a young child? And I don't know what the answer to that is, but I know that working with him, after I kind of like broke the walls down a little bit, and he would smile, and he would he was motivated to still be doing stuff, and he would try harder. And even though like we knew that it was I don't even know how to say it. Like we knew that his diagnosis was not favorable. You still try, and you still do everything that you possibly can to improve that person's quality of life, even a tiny bit.
Mm-hmm.
And I had such a profound experience working in that clinic, and everything that you just said, I hope that resonates with other people that are like maybe a little bit hesitant to work with somebody who has cancer, who has another type of medical condition that is terminal, because you can be a part of the last days, but
Mm-hmm.
maybe some of the best days.
Yeah. I have one more, and sure, but
Please.
it's like
No,
one
we
more
have
little
time. We have
story.
time. All the
But
time.
just speaking of like quality of life, right? So I had a lady, she was so sweet, and her and a husband would come in every visit. She would never miss, even if she was throwing up before, she would always come in, and like we would like work on, like we would walk on the treadmill, and like really I gave her confidence. Like she felt like if she could walk on the treadmill and she could work on some strengthening stuff with me, that like it just gave her confidence to live again. And she ended up passing, but like a month after she passed, I got this letter in the mail to my office, and it was her husband, and her husband wrote me a letter and said that she had passed, but he was like, he said he was so grateful for the time that his wife had to spend with us, because he said that because of coming to PT, she went out with her friends because she felt confident, and she went to go see her daughter, and she got to go to lunches and dinners because she gained confidence for what we did. And he's like, I can never say thank you enough for giving her life those last few months. So, you know, it didn't seem like a lot when we were doing it, but to get that letter and to hear the true meaning of what we did together was I'll never forget that either. That letter, you know, that letter of a thankful husband. So
I honestly am like a little bit speechless, and that doesn't happen very often. You know, you know that. Others who know me know that. But I just remember all of my experiences there. I had some sad days where, you know, I was mourning with my patients, but at the same time, I had so many amazing days where I helped people be able to just stand up from a chair, and they thought that they couldn't do that ever again, just to stand up from a chair. How big of a change to your quality of life that you can independently just stand up on your own, and you don't have to rely on somebody else to do that. I mean, I
know the good days I'll say far outweigh the bad. And even the bad aren't that bad. They're still good because you're with somebody and you're making a difference. So yeah, there's this is a little plug, but at the APTA there's this it's part of the oncology section, and it's called Celebration of Life, and they all get together, and it's a bunch of oncology therapists, but we all get together and remember somebody and remember our patients. And so, you know, if anybody ever wants to go check that out, it's really cool and it's really profound, but you really make a difference in people's lives.
That's at CSM every year, right?
Yep.
Yeah. So awesome. It's so awesome. And I just really hope that, like, anybody who does end up listening to this, I don't know, like, Mom, I know, yeah. My husband, he won't even listen to it. He'd be like, this is interesting. My name is Ben. Anybody who does listen to this, if you're a physical therapist, especially in outpatient ortho, which is the vast majority of us, working with this population, like, cancer is on the rise. You will at some point in your career work with somebody who has cancer or has had cancer or is diagnosed with cancer in the middle of your treatment. Or maybe they come to you with a pain or like something weird, like a gait dysfunction, and they end up, you know, it turns out it's because they have a tumor or something. But you will work with them. And I just hope that this, by listening to this, it gives you the confidence to be able to want to stick it out with them, and also to build a network of individuals that you can reach out to. That's the whole purpose of you know, my new website, and the direction that we're going is to build up a network of multidisciplinary specialists that can trade ideas and ask questions of one another and just collaborate in general. And party, you know, like maybe we'll all get together and party sometime.
Work hard, play hard.
Yeah, exactly. So Oh my God. Oh my gosh. So this is something that's funny, and I should have mentioned at the beginning, but me and Rachel have the same exact birthday. We were both born
to the date, to the year.
to the day, to the year, same exact birthday. So we were just like meant to be. What's funny is, like, you know how they say people who are born on a certain day are pretty similar?
Mm-hmm.
I would say me and Rachel have a lot of things in common, but we're actually pretty darn
We're very different. Yeah, I know, we're so different.
so different.
But it's great. It works out.
Yeah. Yeah. Like I'm like the
Except
extrovert, you're kind of a little more introvert.
Yeah.
Or yeah.
Katie's like the prompt, always on things. I'm the procrastinator. Like Katie thinks I'm dead most of the time because I never respond to her. So
Right, like sending Rachel a text message is like you have to send her at least 770
probably, yeah.
to get her to reply. So I just
What
keep
up?
sending like one emoji after the next, like send.
One day I'll respond, I promise.
Gosh. Well, I know that it's not because you don't love me or care for me. Like I know
It's
it's just
like,
your brain
I hate
and
the phone. And like I read it and then I forget about it. So
yeah, it's no big deal. But anyway, I digress because me and Rachel have the same birthday, so that just gives us a reason to party together every year.
That's right.
On the same date. But also, you know, any other day that we're ever together.
Sorry,
and I don't party that much. Everybody knows that because I have a 2 and 3-year-old and am married and boring now.
It's like life makes you really tired.
I go to bed at like 9, so you know.
It's my favorite time to go to bed.
I know. So in conclusion, Rachel, is there anything else that you want to share with the world or or your mom, the only person that's listening?
What up, Vic?
Yeah, Vicky. Oh man. Is there anything else that you want to share to inspire, to any last little comments or cases you want to share? Anything?
I would just say what I would like to share and impart is that, like, I never knew that I would have such a big love and passion in my heart to help people who have been diagnosed with cancer. But it's been one of the most profound changes in my life to work with these people. And so I can't expect everybody to share that passion with me, but I hope that as physical therapists, we don't look at cancer with this not negative light, but like indifferent light, but maybe look at it as such a place to shine as a profession and such a way to shine as a person.
Mm-hmm.
So, you know, I would encourage people to be more open-minded, to think more critically with these patients because they've been through a lot. They've been through a lot physically and emotionally. And so it's our duty as therapists to realize that and to treat them as a whole person from their history to who they are now. So I would just encourage people to maybe look at it from a different lens than they have and kind of see things through their patient's perspective and just a different therapy perspective. So being open-minded and liking the challenge and researching those things for the betterment of your patients and you as a therapist. Like, I think that's so important. So
badass.
Ooh.
So badass. Am I allowed to say that? I mean, I can say whatever I want, right? Like, this is
just edit it if you don't like
it. No, I'll leave it in. That's okay. So Ben and I were talking about, I guess somebody from his internship was like, Ben, what's your brand? And
oh gosh,
he was like, because you know Ben, like my husband is like, he doesn't have much of a brand.
My beard? Like.
Yeah, he's got a beard and that's about it. No, he's great. Love Ben. Love you, sweetie. But no, like my brand, or how did I even get on the subject? Oh, like yeah. So I have a little bit of ADHD. I think most people that know me knows that. But like my brand is edgy, millennial, I guess. I'm definitely a millennial. And I don't know. I just don't care to be super formal. I just don't. I want to keep things light and low key and
Real.
Yeah, and real. And like, you see my t-shirt?
Oh my gosh, that's awesome.
It's my favorite new t-shirt.
That is so cool.
I wore it in the anatomy course on Sunday too, so
Freaking awesome.
now I'm like wearing the same t-shirt all the time. Man, I'm just turning into a slob.
Stains. At least it's black. Nobody can see the stains.
Yeah. Well, thank you, Rachel, for
Oh my gosh, it was fun.
This was fun, and I think we should do another one where we talk about dry needling and
Okay.
like kind of going against the grain with we sort of mentioned it a little bit, but these like textbook contraindications that they have not been even studied. They're just like theorized, and we're going to talk about that maybe in another episode.
Yeah. I was going to say, preview, I'm like trying to start a little study to look at dry needling and neuropathy. So maybe I'll have something more to share.
Yeah,
once
cool.
I start getting patients. So
yeah, because I guess like a little preview, Rachel and I had worked on a couple of cases, especially with individuals with cancer or in remission from cancer who had some spasticity and neurologic deficits. So we used electrical dry needling to help reduce spasticity and improve motor function. And we actually had some pretty fantastic results just in our clinic. And we didn't really have any parameters to go by. We were just trying it out. And based on our theory and our understanding of what was safe and what was appropriate, risk versus benefit, we went ahead and did it. And Rachel presented it at CSM. She had an awesome platform presentation and got an award. She was like the winner of the platform, the Oncology Academy platform. And oh my God, it was just so awesome. Like that was such a great case. But anyway, that's like a little preview for next time. And we'll just end there because then I'm just going to keep talking.
I know. People are like, okay.
All right. Peace out, y'all.
Thanks for listening to the Redefine Health Ed podcast. Stay tuned for more episodes every week. If you haven't already, visit our website at www.redefinehealthed.com. We have 2 courses coming up within the next week. May 12th, we have the Introduction to Musculoskeletal Imaging from 7 to 9 p.m. Eastern. And May 15th, we have lumbar screening for the health professional from 9 a.m. to 12 p.m. Eastern Time. And if you haven't already, go ahead and subscribe and follow us on all our social media platforms at Redefine Health Ed, except for Twitter, Redefine Con Ed. Take care, everyone.